saw someone make a video about how much does healthcare cost in the United States, and I just got a bill from a hospital stay that I had, and I thought that I would share it with all of y'all. Thank God for insurance, because if I was paying for this out of pocket, I'd be paying it for who knows how long. So I had been having stomach issues for about a month, and I am pregnant, and so I got to the point where I was just getting really nervous, so I decided to go to the emergency room since I couldn't get in with a gastrointestinal doctor for like 3 months. So I went into the ER. I was probably there from like 11 to 3 o'clock. Let's look at this itemized bill. Number one, sodium chloride, $15.75. Fine. It says angiocath. I guess that's, I don't know what it is. $24.21. Comprehensive metabolic profile. So they did my blood. $1,406.54. Magnesium, serum magnesium, $659.50. They did a complete blood count, which was $861.62. They took a urine sample, which cost $655.28. And then emergency room general, ER extended, level 4. So I actually called up the billing department, and they said based on questions that I answered, they give you a different level. She sounded like she had no idea what she was talking about. But again, I was there from like 11 to 4. I had had diarrhea for a month. Like, I wasn't bleeding out. I didn't have a gunshot wound. Couple hours. $14,610 for a grand total of $18,233.19. Thank God we have insurance, so what I owed was $211.52. This is why I get on this app and talk about how health is so much more than just what you eat and how much you move. Having access to healthcare is huge. Like, how I know so many people, myself included, that avoid getting care because they have to decide between their health and maybe paying for the rent or groceries or just having money for life in general. Just a little reminder that health is complicated and we can't reduce it down to what you eat and how much you move.
The cost of American medical care and the medical insurance, it's a disgrace. If you go to Singapore, you will find that they do the whole thing better than we do, and it costs 20% of what we pay.
And again, my audio was
And by the way, I have no idea of how to get from where we are to where Singapore is, because all the people that are getting all that extra money fight like fierce tigers to hold on to it.
Right.
And they control boards and cities and states and every other guy. So I don't know how to fix the costs in American health care. They're totally out of control. And Warren tried to fix it with Amazon and all that stuff. He failed too. Everybody's failed. Everybody in America has a marvelous record failing. And
I just got my hospital bill. I was in there for 3 days for a leg surgery, and I'm going to read you the itemized charge list. First, semi-private room and bed changes, $12,487. Changes for drugs and IV solutions, $2,222. Medical surgical supplies, $2,918. Clinical laboratory changes, $5,314. Operating room charges, $7,749. Anesthesia services, $2,157. Physical therapy, $874. I literally had no physical therapy. I had surgery and I walked with a nurse when I got out. And I was the one who said I wanted to walk on my own. I literally held some random nurse's arm. Emergency room services, $5,615. Recovery room services, $1,948. For a total of a whopping $41,288. Free that boy.
So I walk into urgent treatment care because I've been treating this little sty on my eye for a couple of weeks now to no avail. And I walk in here, haven't even seen a fucking doctor yet. And just to get to see a doctor is $155 for nothing. And I gotta wait in the truck for God knows how long until they get to me. I haven't even seen a doctor yet. That's not going to include the medicine to take care of it.
$155.
$155 just to get your foot in the door.
For urgent care.
For urgent care.
Oh, I'm sorry. It's fast-paced health now. What the fuck?
And this is why our fucking healthcare system is crumbling. This is why our economy is crumbling. Because fucking bunch of rich fucks are parasites on people like us and me and you and every fucking buddy else. Because they want to make money on this. It should cost pennies to fucking fix, but instead it costs hundreds.
If we were in Mexico, we probably could have spent like $10.
And I'd be walking out of there right now.
Yep. In and out.
In and out.
Yep. God bless America.
Been there, fucking done it. They got it better than we do. Fucking third world country, my ass.
This is what happens if you don't pay your medical bills in America. You basically have 30 days to pay your medical bills, and they will call you and basically harass you every single day to pay your bill. After it's been 60 to 90 days, they will sell your medical bill to a collections agency where your medical bill will start gaining interest. And from there, they will also start harassing and calling you and basically telling you to pay your bill. Depending on how impatient your collections agency is, they can take you to court and sue you, and they can go after your wages, your paychecks, your car, your home, until that medical bill is paid off. It also really depends on the amount too. Like, I don't think they're going to take someone to court for a $100 bill. I know that your medical bills can't affect your credit score, but once they do sell it to a collections agency, that's when it can. However, a lot of people actually don't know this, but you can actually negotiate your bill and by a lot, like half the cost, because at the end of the day, all they want is your money. Yes, you can also do this with your collections agency too. You can also do monthly payments too, and as long as you're making monthly payments on your bill, they can't come after you. So you can literally pay $1 a month and they can't come after you. Usually if you don't have insurance, there's usually charities that will help cover your costs. Even the hospital themselves will give you a discount if you don't have insurance. I know there's a lot of people that will say that their medical bill disappeared without paying for it. That's because either the collection agency gave up the cost of it, like you probably just owed like $100 and they're like, it's whatever. Or because they're gonna come after you years later once your bill has gained a lot of interest. So yeah, that's basically what happens if you don't pay your medical bills in America. Unfortunate.
Now, when you get sick, you go to the doctor, right? How much does it cost you to go in?
Nothing.
Nothing? Oh, my God. All right. In America, you get sick, you go to the doctor, you have an insurance plan, all right? And the doctor says, okay, your deductible has not yet kicked in. What does that mean? You got to pay it depending on the plan. And there are hundreds of different plans. On average, let's just say you're a family of 2-3 people, you got a $10,000 deductible. You know what that means? That before your insurance kicks in, you got to pay the first $10,000 out of your own pocket. You got that?
Yeah.
Now, if you got hit by a bus, all right, you ran up a $100,000 bill, it is likely the insurance will kick in the $90,000. But if you are simply sick, or your kid is sick, you got to come up with the first $10,000. And what happens if you're making $60,000 a year? You're going to say, you know what, I can't afford that money. So
my medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's district.
People ask me what's wrong with healthcare. Why is it so fucked? Why do we spend the most money and have the worst outcomes? And it's pretty obvious, I think. The incentive structure, like anything in America, it's about making money. So how many drugs can you prescribe? How many surgeries can you do? Like, they obviously don't give a fuck about the outcomes. Like, outcomes aren't even discussed. They'll just cut anybody open, prescribe anybody some fucking Mounjaro, and send them on their way. So yeah, we need to fix the incentive structure.
Why do medicines cost so much more in the United States than any other country? They just keep coming up with new ways to just screw us harder and harder. I know we're the top GDP in the world, but that's a very small percent. Most people are poor. I work in 5 counties in Georgia, from suburbs out to very rural, poor areas, and we don't have no money. Nobody does. My stepmom is from Colombia. She has dual citizenship. And my dad here in America was quoted $7,000 for some dental work he needed done. Well, he goes to Colombia, South America, and gets it done. You can go there, get a plane ride there and back, go on a vacation in Cartagena, and get your dental work done for less than you could just get dental work done here. Make this make sense.
Many people have asked why doctors prescribe so much psychiatric medication if there are so many risks involved. The simple answer is money. Number one, big pharma equals big money. Psych meds are the star revenue producers for the drug companies. In 2011, Big Pharma made over $18 billion in antipsychotics, $11 billion in antidepressants, and nearly $8 billion in ADHD drugs. Number two, research and academia are not actually objective. There are many financial ties between clinical researchers and Big Pharma. A 2021 JAMA study found that in the commentaries they studied, 20% of authors had a disclosed conflict of interest, 31% received payments from trial sponsors, and 96% received payments or research funding that had not been disclosed. There is also publication bias. Papers that are critical of drugs are suppressed and rarely published because journals don't want to jeopardize advertising revenue. Big Pharma also pays newspapers and magazines to run articles. Number three, the data are not what they seem. Many patients, and sometimes researchers, can tell if they are receiving the drug or the placebo because of side effects. Maintenance trials do not reflect a true placebo because they have withdrawn people from meds. To get FDA approval for a drug, you need 2 studies that show a benefit. However, there are frequently many other studies that show no benefit.
This one will shock you. The largest merger ever done in Germany was Bayer Monsanto, where Bayer, which is a pharmaceutical company, merged with Monsanto, which is an agrochemical company in the United States. If you look at what Bayer makes, they make cancer drugs for things like non-Hodgkin's lymphoma. And if you look at what Monsanto makes, which is Roundup, which is the most widely used pesticide in America, the cancer that it causes is non-Hodgkin's lymphoma. They paid out $11 billion in the past couple of years for non-Hodgkin's lymphoma cases. So the companies are merging that are directly known to cause the disease with a medical company that has a treatment for the disease. Like, this is very, very dark. And so like Callie said, it's kind of this revolving door between create the illness, treat the illness, and hide the science that tells us what's happening.
But this is all a result of the food industry wanting food cheaper. And we spend per capita half as much on food as they do in Europe. But we spend 3 times more per capita on healthcare. So my big point to everyone is this is not the free market at work. This is food companies lobbying to have neurotoxins and endocrine disrupting chemicals on our food that are toxic, that aren't allowed on any other food in any other developed country, in order to make food a lot cheaper. And then to your point about, what do these chemicals do? It increases estrogen. And these kids are inhaling hormone disrupting chemicals. So
and now
the New York Times recently had a front page article that puberty rates, particularly among women in the United States, are plummeting. People are hitting puberty years earlier, younger. Girls are hitting
how
puberty.
young?
The average girl in America is hitting puberty, which is sexual maturity, 6 years earlier than they were in 1900. We have the earliest puberty rates of any continent in the world. It's age 10 and 10 to 13. And this is in large part thought to do because of we're literally giving children estrogen with all the plastics we're ingesting, which are xenoestrogens, meaning they are exogenous artificial estrogens, and the pesticides, which can activate the estrogen receptors like atrazine. I mean, you can put atrazine, which is a pesticide that we spray about 70 million pounds of in the US every year. It's not legal in Europe, but it's sold to us from international countries.
It's not legal in Europe?
No, you cannot use it. And you put this on a developing male frog embryo and it turns into a female frog. That's how much of an endocrine disrupting chemical that it is.
This is the biggest scam in the history of Big Pharma. I'm a licensed pharmacist in 3 states and a medication pricing expert. Duexis is a perfect example of a no innovation, no utility, no research medication that has scammed Medicare out of $100 million, probably more. Duexis is a combination of ibuprofen and famotidine, and if that sounds familiar, it's because they're 2 over-the-counter medications that you can buy without a prescription for literal pennies. This company, called Horizon Pharmaceuticals, put both of those into one pill and gouged insurance companies for, are you ready for this? $2,500 per bottle, a 1-month supply. And what's even stupider about this is Medicare actually paid for it. They spent approximately $40 million per year on it between 2018 and 2021. It was an absolute scam medication that should have never existed. Its only purpose was to price gouge insurance companies, a pump and dump of the pharmacy world.
The Sackler family, one of the country's wealthiest families who owns and operates Purdue Pharma, the creator of OxyContin, has been granted full immunity in exchange for paying $6 billion. Some context, in 1996, Purdue Pharma developed and patented OxyContin, resulting in the initial wave of fatalities associated with illegal prescription opioids. Most recently, another wave of fatalities has emerged due to the prevalence of illicit synthetic opioids, leading to what we know as the fentanyl crisis. When asked about its side effects, Purdue Pharma provided a misleading portrayal of the drug, falsely representing it as less addictive compared to other opioids. Since 2017, the Sackler family has been facing civil lawsuits for the drug's impact on families. However, as of this week, New York Court of Appeals has granted the Sackler family immunity from present and future lawsuits related to their involvement in the company's opioid business. In exchange, the family will contribute billions of dollars to combat the ongoing opioid epidemic. The family also announced it will relinquish their ownership of the company. Do you believe this was fair? Let us know in the comments.
People outside of healthcare don't understand the problems going on inside of healthcare. Nurses and docs don't want to comment on how bad it is. All types of healthcare workers don't want to make it seem like they're complaining. But in reality, these people are suffering. And these are super important people to our healthcare system and to our patient experience. We need to protect these people. We need to bring light to these issues.
Lately, working in healthcare is giving ghetto. It's giving white refrigerator. It's giving, girl, put your shoes on and let's find you a home. And it's not because of the patients, it's because of management. It starts off with them not wanting to hire replacements for the people that retire or leave. And so then here we are in our departments, overworking ourselves. Girl. Then it goes into them wanting to incentivize overtime. Listen, having a bonus on top of your overtime, it sounds cute on paper, girl. But you know what they're really incentivizing? They're incentivizing you overworking yourself. They're incentivizing you spending less time with your family, your friends, and your partner. They're incentivizing you spending less time loving on yourself. Why? Because you're working. Lastly, it's them not wanting to give us the supplies that we need to do our job correctly and efficiently. I'm sorry, I didn't realize I was gonna have to be Mary Poppins at work. Like, girl, do I need to bring my own toilet paper? Do I need to bring my own sabanas? Girl, get out of here. It's giving ghetto. It's giving very much so ghetto.
You know, it's called work-life balance for a reason. Because you're supposed to balance your work life with your personal life. And I have been a respiratory therapist for 10 years. And as much as I love my career, I am not going to allow the profession of respiratory therapist or any hospital that I am working at to kill me. There was a doctor that died at work at one of the facilities that I worked, and this happened a while ago. And this man stepped off the unit and they started calling his phone and he wasn't answering. So after a while, when he wasn't answering, somebody went to go hunt him down. They found this man dead in his office at the hospital. And when they touched him, he was cold to the touch. meaning he had been in his office dead for a while. And don't allow yourself to be fooled or tricked into thinking that there's some big, beautiful prize at the end of working yourself to death for any job. They may even recognize you. They may say your name in a ceremony, but at the end of the day, you are an employee and you were given an employee number. Treat it as such. When I am at work, I am there 100% to do what I was hired for, which is the profession of respiratory therapy. And I'm going to do my job and I'm going to take care of my patients. And if my shift happens to be short-staffed while I'm on the clock, I will deal with it because I am already on the clock. But what I am not going to do is allow myself to be harassed, called at home, and begged and harassed to come in to cover for a shift that is already short, that I'm not responsible for working. You have a lot of these managers that want you to give your life to the hospital. And some of them will get an attitude when you don't pick up shifts or you don't pick up overtime. I wasn't hired for that. I wasn't hired to work myself to death. But at the end of the day, these jobs don't care about you. They care about what you're able to produce for them. Treat it as such. When I'm there, I am absolutely going to do my job. I'm going to do everything that is required of me. But when I'm not there, I am going to enjoy myself away from work, which is what I'm supposed to do. Again, work-life balance. Bye.
That's not what I'm talking about. Please get a manager, man. I don't want to talk to you because I want to say it one time. No, please don't want to talk if you say it once before I pass out. Go get the manager or the charge nurse. I'm going to tell you and her at the same time, one time.
I would gladly do that, but before I do that, I need to do one thing.
What do you want?
I want you to mask on.
No, I'm not going back down in that hallway because I just came from out of there. And if I had stayed there, I probably would have died. Go get her.
Then you can sit outside for me to get the manager.
Miss, what's about to happen is a goddamn lawsuit. If you don't stop talking to me and take your ass back there and go get your person.
I'm not getting anybody until you're where you're supposed to be. So once he decides,
I'm where I'm supposed to be right here because y'all left me in the hallway over there to die. I'm not going back in that fucking hallway.
wait outside. You have the right to refuse to test me.
I bet you better go get me some goddamn medical help. I bet you that.
Back there or outside the safe, I'll gladly get the supervisor, but you can't wait in the
Yeah, get her. Go get her.
I'm not giving anybody till you're where you are, just so we're clear.
About my, get off the phone, whoever that is. No, get off the phone. Get off the phone. No, get off the phone. Get ready to call the police and 911. They refusing me medical attention and I'm sick. Hello. I ain't doing all that dumb shit.
Here's the most annoying thing about being a nurse. It's not the patients, it's not the doctors, it's hospital admins. Because I got written up for wearing this sweatshirt at work. You can't tell, it says Navy. That plain sweatshirt with just Navy on the top. I'm on night shift at 7 a.m. and my boss walks in, looks at me and says, "What are you wearing?" And I go, "This?" "Mm-hmm." And I just said, "Oh, it's just a sweatshirt because I just threw it on last night because it's cold in the hospital." And she goes, "Huh," and walks away, and then I get written up. There are just so many big problems in healthcare, like understaffing, underpaying, running out of supplies. There are big issues, but they just love to micromanage these tiny little issues that don't really matter, like me wearing a sweatshirt. I love working in healthcare.
I couldn't sleep last night, so I made a 7-step plan to fix the American healthcare system. Right now, we spend $4.9 trillion a year on healthcare, more than any other nation on earth. And what do we get? Worse outcomes, surprise out-of-network bills, and endless denial claims. Step 1. Create a public healthcare plan, nonprofit, full coverage, no deductibles, no surprise bills, and open to anyone who wants it. Cut out private insurers. This removes their profit and bloated bureaucracies, saving around $275 billion a year. Make the care itself nonprofit, hospitals, clinics, all of it. Stop letting them pull billions while charging us the highest prices in the world. Negotiate drug and procedure prices. Every wealthy country does this. We can too. This saves around $300 billion. Phase everyone into the new public plan through attrition. As people change jobs or renew plans, they move to the public system. Anyone starting a new job goes on the public plan. Over 8 to 10 years, everyone transitions to one system. This includes veterans. Your paycheck is going to look different. Right now, your employer spends thousands every year on your health insurance. Money you never see. Under this plan, that money goes straight into your paycheck. Your income goes up, and part of those funds go to the public plan, just like it used to pay for your employer plan. We use the trillions in savings to rebuild healthcare where it's needed most. That means reopening shuttered rural hospitals and investing in neglected urban communities that have been without quality care for decades. The cost per person drops to about $8,000, down from $14,000, saving nearly $2 trillion a year. And finally, building a system that works for the people, and we stop paying twice what the rest of the developed world pays for quality healthcare.
Simple solution to fix the American healthcare system? Put the doctors in charge, not the insurance companies who don't go to school for 10 plus years trying to figure out how the human body works and how to heal it, instead of focusing just on capital gains. Just a thought.
This is also very true. I believe that if people would start looking abroad, healthcare in America will become cheaper. There's two ways to change the system. Policy, which is very hard, or making the system bleed. How do you make the system bleed? By collectively avoiding to use the system. You get diagnosed in surgery in America. For the price of diagnosis, you can take a flight to Italy for $100, get diagnosed and cured in the same week by a private doctor, and come back for less than what you would pay out of pocket, even if you had insurance. You might be saying, yeah, but I have a job. You might say, instead of taking PTO to go get drunk in California, take a flight to Italy, you get diagnosed, you get cured, and have a 1-week vacation in Italy. You get cured in front of the Colosseum instead of getting cured in front of a McDonald's. Simple, easy, cheap, and good food and the life experience. Do it collectively, billions of dollars flowing out, send a signal to American healthcare system. Oh, it's funny. I believe that everybody should have 2 insurances. Basic emergency insurance in America, just for when you need stuff done now, and then one for non-elective surgery abroad. An insurance provider should even create an insurance that includes flights or something like that.